This podcast is for informational purposes only and does not provide medical advice. Always consult your physician or other qualified health provider with any medical questions and never delay care because of something you hear on this podcast. Welcome to Prostate Cancer Real Talk. Did you know that 1 out of 8 U.S. men will be affected by prostate cancer? And Black men are 50% more likely to be diagnosed and twice as likely to die from it. Meet Elle and Shay, a married couple impacted by prostate cancer who have faced it, fought it, and defeated it. Join in now where we answer questions, share personal stories, and fellowship in our safe, judgment-free space. Expert guests include urologists, surgeons, researchers, counselors, nutritionists, patients with their families, and more. If you or someone you know has been impacted by prostate cancer, you've found a welcoming place for information and support.
Today, we welcome Clarence Williamson, a prostate cancer survivor and passionate advocate. As co-founder of the Man-to-Man Support Group and an active member of several national advocacy organizations, Clarence has dedicated himself to raising awareness about prostate cancer. Diagnosed at 54 and now a long-term survivor, he champions the importance of early detection and PSA testing. Elle and Shay, take it away.
Today, we're going to talk to Clarence Williamson, who is a long-term survivor of prostate cancer. Many times when we get the diagnosis of prostate cancer, sometimes our minds go to the worst case scenario. And we're here to talk about the fact that it is not the end of the road, so to speak. You can have a long, fulfilling, and productive life, literally decades after you are diagnosed. And we'd like to welcome Clarence to our show today, and he's going to be sharing with us his story. Hello, Clarence.
Hello, Elle. How are you?
Really, really well. And hello, Shay, to my lovely co-host and wife. Shay, hello.
Hi, Elle. Hi, Clarence.
Hey, Shay. How are you?
I'm good, thank you.
So, Clarence, as we, share with our viewers your journey, can you kind of give us a quick overview in terms of when you were diagnosed, how long ago it was, and the encouraging story that you have to share in terms of the duration and your survival decades after your diagnosis?
Okay, Elle, I think that we can start before I was diagnosed. I was seeing a urologist on a regular basis, like an annual checkup, and everything was going well. There were no symptoms or signs of that I was sick in any way, seriously sick. But in like September of 1997, I went to see him, and he told me I had an elevated PSA test. And I had no idea what a PSA test because he had never mentioned it before. Well, what he did was explain that a elevated PSA might be a sign that I've got some prostate cancer issues, but we won't jump to that. We'll do a second test in about 4 months, 3 or 4 months, just to verify the results. And what happened with me was I didn't get a second test for about 6 or 7 months. Unfortunately, or fortunately, however you want to put it, I relocated from Chicago to Memphis. It was like April or May of 1998 when my allergies were bothering me. And I went to a regular primary care physician. And at that point, I was asked when was the last time I had a exam for my prostate. And at that time, it dawned on me that I had an elevated PSA and hadn't had a retest. So I gave this information to the nurse practitioner, and he said, well, the first thing we'll do is we'll have to do another PSA test. And that PSA test that office did, it roughly doubled my PSA from 6 to 7 months previous. So The first elevated PSA was approximately 3.5. And then the one that I got done in Memphis was like 7.5. So from there, he recommended that I go see a urologist and do a follow-up because they were primary care. Referred me to a urologist, and some of the same things happened. He didn't do another PSA, but he did what we call a digital rectal exam, where physically examine my prostate and digital, they call it digital because it's the one finger, first digit of the hand. And men, that's the biggest fear that men have when it comes to prostate cancer diagnosis, is they do not want a man or a woman examining a prostate because they go in through the rectum. So it didn't bother me. I had been examined by doctors many times over my life, and not that way, but I accepted it because the man said cancer. And so I was willing to do whatever I need to do to find out what's going on with my body. So the urologist did a digital rectal exam, and several days or a week later, it came back that I was positive for prostate cancer. They have what they call a Gleason score, and this is one of the earlier methods after an elevated PSA. The Gleason score is the next step from a digital exam. And my Gleason score was like 3.4, which is significant, not super significant, but significant to the point where it verified that more than likely I had prostate cancer.
So when you say 3.4, are you saying 3 plus 4? That came up to be a 7, correct?
Correct. Not 3.4, but 3 plus 4.
Right.
Yeah.
And the reason why I'm so familiar with that is because that is my exact, that was my exact reading for my Gleason score. Okay. So, please continue.
Yeah. And so at that point, he gave me a book to read about prostate cancer and explained to me what that result meant, and the 2 elevated PSAs, and welcomed me to get a second opinion, which I thought was, okay, how many doctors are going to get this kind of information and immediately tell you get a second opinion? And that was good for me to hear, and I recognized that. But some time passed before I got a second opinion. I was busy, how we get busy, and I was dedicated to making sure that everything was successful as far as my move to Memphis went. And I kind of put it on the back burner. I called the doctor, and we finally got an appointment, and we got an appointment like early August. So maybe 3 or 4 months had passed before I got a chance to get a second opinion. So he did another PSA, and we talked, and he gave me some more literature, and we scheduled another appointment to discuss when the results came back. And the results did come back about a week later, and my PSA had doubled again from like 7.5 to 15 in another 3 or 4 months, from March of 98 to August of 98. And so we sat in the office and we talked, and I maybe backtrack. This was like September by the time we got our second appointment with Dr. Steiner. And we talked, and he was very diligent in explaining all the options. And this was still 1998. So we scheduled the surgery because he was so thorough in all his exams. And September 1998, I had what they call a radical prostatectomy, which meant that it was open. Years later, about 5 years later, they started doing something called robotic surgery. And today, a large majority of prostate cancer surgeries are done through robotic, which is not as invasive. After the surgery, the next morning, the surgeon came in and he said that all of my margins were clear. That's the outside of the prostate cancer bed. That meant there was no cancer there, and the lymph nodes that they tested, there was no cancer there. So he said that we got it all, and my wife and I really felt great. And in a day or so later, I went home, and boom, that was my cancer, and I thought it was all gone. But unfortunately, cancer, especially prostate cancer, is not always all gone. So I was going every 3 months doing exams with repeated PSAs to make sure the PSA wasn't increasing. My results were virtually zero. A year and a half or 2 years later, my prostate cancer came back, which happens quite often. I was referred to a oncologist rather than a urologist. And the oncologist, what he did was my oncologist went through the process of treating my prostate cancer once it had returned. Because when it returns, it's diagnosed as metastatic prostate cancer. And my prostate cancer returned in my bones, which is one of the places it returns to mostly for prostate cancer. And the treatment for me was the protocol was something called androgen deprivation. We refer to it as ADT. And that's a hormonal treatment that prevents your PSA from rising, prevents your body from producing testosterone. And the way the doctor explained it to me, it would go all through my body and get to the cancer cells in my bones and keep them from growing. So I started that. And I guess by this time it was maybe 2000, 2001. And I stayed on ADT treatment for a number of years. As a matter of fact, I'm still on another version of ADT treatment. But through it all, my wife and I have found a way to be positive about my treatment and positive about life. And the message I want to get to all men is that life doesn't stop because you've been treated for prostate cancer. I still have the side effects that are common with prostate cancer. I live with them, and I have a positive outlook that as long as I'm being treated with the protocol, the best treatments of today, then I'll be okay. After I started the ADT treatment, I was so grateful that I wanted to give back to other people that were treated, other prostate cancer survivors, because what I began to learn and understand is that men, by and large, ran from prostate cancer. If they heard the word prostate cancer, immediately they would turn away and didn't want to hear about treatment, didn't want to hear about symptoms. And so I found a way to get involved with the advocacy. Early prostate cancer usually has no symptoms. And just like I was diagnosed, I had no symptoms. I was 53 years old, felt great. And then the doctor said, you got prostate cancer. So sometimes it's hard to believe. I don't, some of the men in our group didn't really come around to the doctor telling them they had prostate cancer immediately. But if you keep going to the doctor, you'll get more information and you'll begin to see that the analysis and the diagnosis of the possible prostate cancer, if they get repeating themselves, then you have to admit that you have prostate cancer.
Hey, listeners, metastatic prostate cancer means that the cancer has spread from the prostate to other parts of your body. If you or a loved one has been diagnosed with metastatic prostate cancer, consider a Pfizer clinical trial as your next step. To check your eligibility, go to www.mevpro-studies.com. That's MEVPRO-studies.com. I want to follow up on a couple of points that you made. You mentioned a positive mental attitude and how important that is. I think many men, including myself, when you get this diagnosis, it is a shocking reality for you to deal with. And eventually you can come around to having a positive mental attitude, but not everyone gets to that point. And we were talking a little bit earlier about how important it is to remain positive and have a positive mental attitude about this. How is that even possible, Clarence? So tell us a little bit about some of the things that you and your organizations that you deal with do to try to keep men encouraged and try to get them to understand how important it is to have a positive perspective on this.
You know, that's one of the most difficult tasks involved with men that have been diagnosed and treated with prostate cancer, because it's such a big change in their life. Number one, it's a scary situation to have been treated for cancer and still know that it's still possibly in your body. How do you deal with that? So I guess each person has to deal with it slightly different, but what we have to have in common is the attitude to know that everything will be okay.
Mm-hmm.
I mean, I don't want to get into a spiritual conversation.
Why not?
But it's like, well, you know, everybody doesn't go that way. So, but I truly believe, based on my life and seeing, experiencing, seeing other people's lives, I don't consider myself an old man. I finally consider myself a senior. It took a while, but a senior. And but it's you know, life is a journey. Really, yes. Life is a journey, and we're all on our individual journey. And what I see and what I've learned is that it's up to us to make the most of our journey.
Right.
And journeys are not simple and easy. You know, some of the twists and turns of my life before I got diagnosed with prostate cancer were quite traumatic. And maybe that allowed me to see things differently. You know, sometimes experiencing something is the best teacher, and then knowing you can come out on the other side a better person gives you some insight as to how to deal with other traumatic incidents that come about. But, you know, prostate cancer or depression with prostate cancer is a common thing, and it's just beginning to be discussed by the medical community as far as how much it affects men, because generally, like I've been depressed on occasion and didn't even know it. You know, if it doesn't hit you strong enough, you just work through it, or you just go through it. So I'm a firm believer that my frame of mind, my outlook is my best tool when it comes to moving forward in life and for healing. You know, if I'm in stress or in fear, I'm preventing my body to do the best it can to recuperate from whatever it's going through. That's my firm belief.
Talk to us a little bit about the importance of opening up and sharing with others your journey, your experience with prostate cancer. How therapeutic have you found that to be?
Extremely therapeutic. I've never been the kind of guy that open up. I've always been an introverted type of guy. And initially, after I was treated, and I didn't open up about it. I think what allowed me to begin opening up was becoming part of the American Cancer Society and hearing other people talk about their cancer. And slowly it just came about. It just came about. And when I had the opportunity to speak, I've done some speaking. I was a guest speaker at one of the annual American Cancer Society Relay for Life events. That allowed me to talk to a large group of people about my cancer. And once I started working with our support group and being the leader of our support group, I had to find a way to talk about my personal life and to open up about my struggles with prostate cancer, because it has been some struggles. It's not easy. It's not for the faint of heart to live with prostate cancer or any cancer, I don't want to make prostate cancer anything special, because all cancer is cancer and they all affect us the same way. But I choose prostate cancer to advocate for, because that's the number one thing that affects the men in the world and in our country and in the Black community. When I found out early on that the Black community, men are twice as likely to die from prostate cancer, it alarmed me. It really did. And that's what made me want to do more into advocacy to get the word out to all men, but especially men that need the information the most.
Clarence, I wanted to ask, so you mentioned that the high rate of depression in prostate cancer patients. So I would imagine that depression probably stems from the side effects of prostate cancer, which, as we know, a large percentage of prostate cancer survivors could experience ED. So when you guys are having discussions, would you say that the depression probably stems from the ED? Because that's what we hear that a lot.
Actually, yeah, ED is the big one. And because it's such a big change in the life of a man. Men are different creatures, and they're born a certain way, and their focus is on different things.
Yes.
So men's focus, I've been told, until they're in the grave. There's always a certain amount of sex in their head.
Yes.
You can perform or not, it's still there. But and that's hard for men to deal with. And that's the first hurdle that I think needs to be overcome when you're trying to understand your journey with prostate cancer. Even before that, the fact that you may develop ED keeps some men from being treated.
Exactly. Yep.
Yeah. There's a certain amount of men out there that die from untreated prostate cancer because they don't want to deal with ED, erectile dysfunction.
Right.
Not knowing that there's men dealing with erectile dysfunction for other issues other than prostate cancer.
Yes.
But yeah, that we talk about it, and sometimes in the group we laugh about it, and that's good. Laughter is healthy. And when you can laugh about a subject that's so serious, it's healthy for you. Years ago, before COVID, we had a guest speaker, and we had a sex therapist come in, and she kind of even opened my eyes. I always want to learn more, but then the way she and there was plenty of wives there. My wife was there, and her thing was that other than sexual intercourse, there are other things just as important in a relationship. And like that word intimacy. And intimacy plays a big part in sex. You know, the physical act is just part of it. The intimacy that's shared is the important part. And a couple can share intimacy without the physical act of sex. And I listen to that. I listen to that because, you know, that let me know that I could do better than just be in a shell, you know, because I think men kind of go into a shell, and I know, yeah, we go into a shell sometimes, and it's hard to pull us out of it.
Right.
And that's what causes the depression part.
Okay.
Mm-hmm.
Just a reminder, to ensure that you stay up to date on the latest episodes from Prostate Cancer Real Talk, don't forget to hit that subscribe and like button.
You've been involved as a prostate cancer survivor and now an advocate for almost 3 decades. Tell us a little bit about what you've seen in terms of the awareness level and the responsiveness, you know, men recognizing that they need to go in for their PSA tests and whatnot. What has been the evolution or progress, if any, within the community, particularly the Black community, for men recognizing the importance of this and then being proactive about getting PSA tests and getting this preventative perspective for prostate cancer? Have you seen progress? I know we've got more to do, but what's your perspective on that?
That's a good question. You know, it's hard to gauge how much progress has been made. But I'm leaning toward, I wish there's much more progress that needs to be made. And unfortunately, I can't see a lot of progress that's been made in the Black community, mainly because of when I'm out in the public and I'm talking to men that have not been diagnosed and know nothing about it, I'm still getting some of the same answers over and over again. Like I'm good, and I had my exam, or I don't want to know, stuff like that. And so those answers have not changed since I've been doing advocacy work, and that's why I push so hard to get education out there. Until our community is educated, it'd be hard for them to make changes in different decisions. So education and awareness is key for the Black community, especially with prostate cancer and overall with all cancers. And is you need information in order to make a good decision. If you don't have the information, then it's hard to make a good decision.
Clarence, I'm just happy to have you back on the podcast. It's always great to see you surviving and thriving. And as we like to say, God is good.
Thank you, Shay. And God is good.
All right. Thank you very much, Clarence. Take care.
Hey, Clarence. Thanks for being on the podcast, Clarence. Thank you.
Thank you for having me.
The study medicine in the MEVPRO clinical trials is designed to block the abnormal EZH2 activity in cells. With the study medicine's help, the abnormal EZH2 no longer promotes cell growth, and the flow of traffic returns to its normal state, and tumor growth is delayed or prevented. The goal of the MEVPRO clinical trials is to determine whether this study medicine, taken as tablets by mouth, is safe and effective. During these clinical trials, you will have regular visits to the study site, and your health and cancer will be closely monitored by medical professionals. You may experience side effects from the study medicine, such as diarrhea and fatigue. More information will be provided during the informed consent process.
To find out more information on the guest you just heard or previous guests and a list of Prostate Cancer Real Talk episodes, visit our website, prostatecancerrealtalk.com. And if you have a question, comment, or if you would like to share your story, send Elle and Shay an email, ellandshay@prostatecare.com. at prostatecancerrealtalk.com. That's L-E-L and Shay, S-H-A-Y, at prostatecancerrealtalk.com.